Together we achieve victory over heart failure.
Hi, this is Dr. Nilesh Patel here, cardiologist from Palampur. So today we'll talk on heart failure. What is heart failure and which population is more prone for heart failure? So some myths are that for heart failure that heart failure means heart attack. No, heart failure is not heart attack. Heart attack is different and heart failure is also different. Heart failure is basically a weakening of the heart muscle. It is basically of two types: systolic heart failure and diastolic heart failure. So systolic heart failure is the weakening of the heart muscles, or sometimes dilatation of the heart chamber, and sometimes also the valve problems are there. Long standing, what are the risk factors for heart failure? The risk factors for heart failure are mainly decreased blood supply to the heart. Heart attack can cause heart failure, long-standing hypertension, uncontrolled diabetes, some viral infections. So these are the few of the more common causes for the heart failure. So we need to first understand the symptomatology of the heart failure. So these patients are probably they will have some difficulty in breathing, shortness of breath. Sometimes they can have edema, pallid edema, swelling in the legs, their decreased effort tolerance, and the easy fatigability. So these are the most common symptoms of the heart: loss of appetite, abdominal fullness. These are the some common symptoms of the heart failure. And these patients need to be are very sensitive and at risk patients. These patients needs to consult to their doctor. They should take proper advice. Regular blood checkups are needed, and regular health checkups are also needed. Once they are diagnosed with some blood reports, electrocardiogram, and today echocardiography, they need to take long-term medicines. And regular health checkup is needed to up titrate as well as to down titrate the medicines for the heart failure which they are taking. And it is also necessary to have some changes in their lifestyle. Not only medicines will improve the symptoms, medicines will definitely improve, but the thing is that the patient should not get the recurrent attacks of the heart failure. So for that, they have to control the underlying risk factors, like that is smoking, diabetes. They need to quit smoking. They need to reduce or stop the alcohol intake. They need to control their blood pressure. The sugar needs to be very well controlled. And if there is any underlying blockage in the heart vessels, then that blockage needs to be addressed. These patients with very advanced stage, they need to undergo cardiac rehabilitation exercise under the proper guidance of the healthcare physician, as well as they need to restrict their water intake and some dietary restrictions. Salt restriction is also needed, as well as they need to undergo proper vaccination so that they are not at risk of again heart failure and some infections which can worsen the heart failure. So it is very important that they should understand the disease, the risk, the pathophysiology, and what is the treatment, and what care they should take, as well as it is also necessary that the cholesterol levels, they restrict the water intake, the patients with heart failure, and dietary modification high, they need to increase their diet fiber more. They should take more fiber in the diet, as well as natural fruits and vegetables is more commonly required, so that and they should regularly exercise, and they should not take stress. Stress is very important because stress can worsen the clinical symptoms of the heart failure patients, and they are again more prone to have heart attacks many a times. And they need to have adequate sleep because and adequate sleep and rest. So these are the things the patients with heart failure should take care. So heart failure is different, heart attack is different. Heart attack occurs when there is blockage in the heart arteries, and heart failure occurs when the muscles of the heart becomes weak or the heart chambers become dilated. Sometimes they can have underlying valve problems. They can have heart rate rhythm disturbances. So in such cases, if the valve pathology is there, they need to undergo surgery for the valve. If there is any rhythm disturbance. Sometimes they need to undergo pacing, biventricular device, or ICD, depending on the clinical condition of the patient. These patients can improve with the medicines. Now there are a lot of many medicines, new medicines have came, Arni and Vericigod. These are the new medicines available with along with the old medicines available, that is beta blockers, SGLT2 inhibitors, MRA, and the ARBs, ACE inhibitors, ARNI, and Vericigod. These are the new medicines available. So with these medicines, patients' symptoms will definitely improve. Patients' clinical function, heart function will definitely improve, but they need to be careful and they need to take the medicines for a long period, depending on the clinical condition and the blood reports and the echocardiography and the advice of the doctor. Thank you.